If we can start from the pre-surgery, well, nutrition is important, but why is it more important in this case, and how we can actually help our patients to get them ready for the surgery?
Absolutely. Kemal, essentially, as you said, nutrition is at the heart of what we do, right? Because nutrition plays a big role in what has happened to our patients in terms of developing obesity and struggling with obesity most of their life. We provide bariatric surgery or weight loss surgery, and the number one goal is obviously to make some changes in their digestive tract so that their body becomes healthier. Their body knows how to lose weight, which is something that has escaped them obviously for years before coming to us. Mm-hmm. But it's not just about, how much patients eat, right? It is critically important for patients to understand nutrition, healthy nutrition. And we spend a great deal of time, obviously, preparing our patients before surgery for them to really become knowledgeable about nutrition. And when we talk about nutrition, Kemal, a lot of people may not clearly understand that there are two big categories that we consider. One is called macronutrients, and then the other one is called micronutrients. And apart from water, anything that we put down our mouths can be really defined in terms of these two categories. Clearly, macronutrients are the things we need in bigger quantity, right? Whether it's carbs, whether it's fats or protein, all the foods that we eat will contain a combination of these, so hopefully in the right proportions, but those are the macronutrients, right? So understanding that is important. But there is another category of nutrients that is just as critically important, but its quantities are much, much smaller. And this is what we call the micronutrients. And of course, we're talking about vitamins and minerals, right? And we need them in much smaller quantities, really often in micrograms per day. But we will miss them dearly if we don't take them because they are critically important. In fact, if you look at the word vitamin, comes from the Latin vita, which means life, right? So they are life-giving substances. And if we don't have, there will be dire consequences to our health, even mortality, obviously, if it's not reversed, right? So these are important. They're important for anyone to conduct a healthy life. But why is it so much more critical for our bariatric patients? Because all the procedures that we undertake in the digestive tract to change it so that the person loses weight will bring about changes in which in the way in which the body actually handles the absorption of nutrients, both macronutrients and micronutrients. And in essence, the net outcome of these surgeries is going to be decreasing the body's ability to absorb these nutrients. And today, obviously, we're talking about the vitamins and micronutrients, right? So we need those things in small quantities. They are provided to us usually in small quantities. So if we create a change that will decrease the body's ability to absorb those small quantities, any reduction in the quantity that we take will have an impact in our ability to get those micronutrients. And obviously, we have to pay attention to that, whether we've done a sleeve gastrectomy where we've changed the size of the stomach and obviously the ability of the stomach to make some changes to the micronutrients. And even more important, when we do something like gastric bypass or the duodenal switch, where we now not only are we making the stomach smaller, but we are rerouting the intestine. So a portion of the intestine doesn't come in contact with that the patient eats, right? Which will mean we're putting a handicap in their ability to absorb these things. So having patients understand this and then become compliant with the need to take vitamins and minerals for the rest of their life, to pay attention to that is critically important for our patients to stay healthy. And this is obviously something we emphasize because we don't want to be trading one illness for another, right? We've liberated patients from the ravages of obesity when we do weight loss surgery, so their blood pressure becomes normal, or improves so that their diabetes improves. These are all illnesses that we are getting rid of. But we cannot substitute them with malnutrition. We cannot substitute them with vitamin deficiency. If we have done that, we've done, a disservice to the patient. So that's why it is so important for our patients to understand that bariatric surgery and not taking vitamins do not go together, right? If you've had bariatric surgery, you have to pay attention to the vitamins you need and to the minerals you need. So to solve this problem, what we do is we teach our patients to take multivitamins that are appropriate for post-bariatric surgery. And generally, those bariatric surgery multivitamins will have additional doses of all the components that one finds in a multivitamin. In addition, we will ask our patients to take extra of certain vitamins, whether it's B12, vitamin D, folate. It will obviously depend on the individual. So the key message here is you cannot have bariatric surgery and then ignore the need of vitamins, because that will be dangerous. It will lead to many problems, including potentially some irreversible neurological problems like paralysis, memory loss, or others. And obviously, we don't want to go there. We want to make sure our patients understand the importance of taking multivitamins. How often? Every day. Often more than once a day, depending on their needs. So vitamins and minerals are critically important to the continued health of our bariatric patients.
We actually recommend this for others who are not going through the surgery, who don't have morbid obesity. Absolutely. Like you and I, Sean was here earlier. Yep. We need vitamins at different levels based on what we do and how we eat and how much exercise we do. So it's not something that we need to do because we have bariatric surgery and we lose so much weight. But it's just like, it's more important because the food intake is a lot less. And therefore, the chances of being malnutrition is a lot higher. But can we just talk about like the overall why vitamins are important for us, not just for the morbid obesity?
Absolutely. So as I said earlier on, vitamins are a class of nutrients that our body needs and cannot do without. It needs them in small quantities. And nature provides those for us in foods that grow or are available, right, in nature. Now, as long as one is getting nutrition directly from its source, in other words, if, for instance, you didn't have to go to the store and we had all the foods that we need in our garden, for instance, right? And then if I wanted a tomato, I would go down in the garden and pick it up. If I wanted an apple, I would do the same. If I wanted an orange, I would do the same from the garden. If we had that, then surely we wouldn't need vitamins to the extent that we are needing them now, because those foods contain most of those naturally needed vitamins in the quantities that are enough for us, right? But the change in our nutritional habits in modern society is been such that very few, if any of us actually are able to get the food directly from its source. In other words, directly from the soil, from a plant, from a tree, etc., right? We go to the store, and within the store, there are no trees where things grow, right? There are shelves, right, where people pick up those fruits, vegetables from gardens, from fields and other places, sometimes thousands of miles away from where we are, right? They pick them, they store them, they transport them, then they store them again, and then they place them in those shelves. So those foods have really lost a lot of their original nutrient content, particularly from a vitamin and micronutrient point of view, right? So if you live in a society as modern and as city-oriented as most of us live in, where we get our foods from the shelves of the stores, then the chances are we're not going to get enough of those vitamins and micronutrients just from the food. That's why we will need those bottles, right, that have vitamins written in them. All of us are familiar with them, and there are lots of varieties nowadays, obviously, but all of them have one thing in common. They have essentially packaged all those essential nutrients in one single pill, and if we take one of those daily, then we will have satisfied them, right? Now, you correctly said, Kemal, that we absolutely need them before surgery as well. Well, guess how do we know that? Simply, for instance, when we see our bariatric patients for consultation, one of the first things we do after we start the process is blood work, right? And we look at the blood work. I can tell you, lots of the patients that we see actually will have vitamin deficiencies, particularly the vitamins like vitamin D, routinely. And then we start supplementing those even before the surgery.
Let's go back to what you were about to start with, choosing the right vitamin. What are the things that we need to be watching? And for our patient after surgery, do they need some more specific vitamins? How do we make that process?
So for the vast majority of the bariatric patients, essentially there are certain vitamins that are absolutely critical for them to take, right? We talk about a multivitamin to begin with, and multivitamin is essentially a packaged tablet that will have, it could be a tablet, it could be a gum, it could be a different other packaging, but it will have most of the micronutrients that are absolutely necessary, right? But on top of that, we want our patients to also take, importantly, two other substances, and that is calcium and vitamin D. And some patients will have to take probably vitamin B12 as well, and in some cases, added iron as well. Okay, so let's leave the B12 and the iron aside. Let's just talk about the first three important substances. One is the multivitamin, as I said. The other one is calcium. Calcium is critically important for our bariatric patients because they may not be able to get enough of it from nutrition. And this is something called calcium citrate, and there are different packages as well. Very often, it's not something that you can take just once a day because it doesn't get absorbed well. So most patients will require actually 2 tablets, generally of 500 or 600 milligram calcium citrate. The other thing that they will need on a daily basis is vitamin D, and typically people will need 300,000 units of vitamin D to be taken as well. Now, then going to some specific groups, for instance, women who are still menstruating and they're losing some blood on a monthly basis, they could be deficient of iron as well, particularly after bariatric surgery, particularly after procedures like gastric bypass or the duodenal switch. So it's critical for them to be taking iron as well, added to their multivitamin. Now, patients who have gastric bypass will sometimes require additional B12 as well, and that comes either in 500 microgram or 1,000 microgram, and most patients will need that. But one critical addition to this vitamin compliance is follow-up. They have to follow up with their bariatric surgeon. They have to follow up with us so that we have an opportunity to do blood tests on a periodic level, right? If we do blood tests, for instance, at the 6 months after bariatric surgery, maybe yearly after that, we will be able to pick up on things that they may be short of before they become major problems, right? So if the vitamin B12 is a little bit below of normal, we can supplement it. But if it's greatly below normal, they could be starting to have major problems. It could be even nerve damage, after B12. Similarly, with vitamin D, with their calcium level and other things as well, it is important that if there are deficiencies, these are caught early on so that we can take measures to supplement them. So we talk about need for patients to become compliant with taking their vitamins, but also that goes along with the need to follow up long-term as well with doctors who are familiar with these needs so that checks can be undertaken in a timely fashion and things can be addressed if they're missed.
So, one of the, I guess, one of my roles in these dialogues to always point out the issue from not just from the morbid obesity standpoint, but for everyone. Vitamin use is important, daily vitamin use is important, because this is not just, again, making the topic more specific for morbid obesity and the surgery process, but we are also, we should be aware of the issue of taking multivitamin, especially after a certain age. But even before you get to that age, I guess it's more important. And like if you live in a 4-season climate, then going through those transitions from summer to the fall, fall to winter, they're always more challenging when you don't have proper, your body doesn't get proper vitamins. So we do recommend for people to take appropriate daily vitamin, regardless of what they are doing, what they're going through, right?
Yes, absolutely, absolutely. So that is definitely because the environment where we live in, as I said, depends so much on processed food for our nutrition, and processed food is notoriously lacking of the many important micronutrients that we need. And so we could put our health in jeopardy in the long term if we are not taking supplementations in the form of a multivitamin, which generally will have most of the micronutrients that we need. Any variety of brands will be fine from that point of view. Anything that a patient will likely be able to tolerate, whether it's chewables, whether it's tablets, will be fine. Now, that's before the surgery. Now, after the surgery, the situation could be even more dire, because now we have made some important changes to the digestive tract with the surgeries, right? So if you take the sleeve gastrectomy, for instance, as you know, the procedure entails removal of a large portion of the stomach, right? And the person will be left out with a much, much smaller stomach that looks almost like a banana. And then if you go to procedures like bypass or the duodenal switch, you will even have an added rerouting of the intestine, which will actually decrease the amount of small intestine that is available to process and absorb nutrients. So with those changes in place, it's going to be imperative that we actually have additional vitamins on board. Not only that we are on a regular schedule of checking for vitamin levels throughout the time, because at any particular period, even taking the multivitamins and the supplements, we could be lacking a particular vitamin or micronutrient.
So
those blood tests are very important.
So what I'm hearing actually is, I don't think we need to read between the lines, but in this case we may. So what we are saying is, post-surgery, your food intake is going to decrease. So which in many cases, we try to do that, right? So I try to do that. You try to do that. But we do it, we have to put an extra effort to do it. But in this case, after the surgery, you are definitely going to have less food intake.
Yes.
So which is kind of a good thing, right? So that our goal is to actually get our patients to lose weight. So with the less food intake, we know that we are on the right direction. So I want to make sure that we point that out, so that it's not like this is not a bad thing. So it's a good thing that you are not able to eat a lot after the surgery, because you don't want you to eat too much.
Right. So the weight problem is happening not because of too much vitamins or micronutrients. The weight problem is happening because we're eating too much carbohydrate and too much fat and maybe too much protein as well, right? So we want to reduce that bulk. We want to reduce it. And that part of what bariatric surgery does is, at the end of the day, you end up eating much less quantity of overall food, right? Now, if the food that you're eating is, let's say, 1/3 or 1/4 of what you used to eat before surgery, then by definition, whatever amount of vitamin or micronutrients you had in that food is going to be reduced by that amount as well, right? But because the vitamins and micronutrients are so small, any reduction of their amount is going to have an impact on it, right?
Exactly.
Great. Which, to your point, essentially, just by reducing the amount of food you're eating, you're already putting yourself in a situation where you could be lacking micronutrients. So intuitively, you do need additional supplementation to make up for that lack of micronutrients that reducing the amount of food is putting you through, right? But on top of that, particularly for procedures like gastric bypass or the switch, on top of reducing the amount of total food that you're eating, we're actually reducing the amount of available surface on your intestine to actually absorb and take in as much as possible from whatever you're eating, right? Because you're rerouting the intestine. So there are many steps now that are affecting your ability to have enough micronutrients, enough vitamins, and enough minerals. For this reason, after bariatric surgery, you cannot have this nonchalant attitude about vitamins. Shall I take it or shall I not? You have to take vitamin. It is very important. And in certain cases, not taking those vitamins could have some very serious side effects in the long term, whether it's bone weakness, whether it's decreased immunity, whether it is thinning of your hair, whether it's inability to heal well if you have an injury or you have surgery, or whether it's even problems with the nervous system, whether it's memory loss or difficulty walking. Those things can happen with certain if certain vitamins are lacking over a prolonged period of time. So this is a very serious and important part of education in bariatric surgery. And of course, it makes up a very large amount of time we spend before surgery to educate our patients. Now, because our patients will have the change in the surgery at one time, but then obviously they have very long life after that, it is critical that they are patients for life with a practice like ours, so that we can follow them over the years by doing blood tests and making sure we focus on the appropriate vitamins also when we assess them on follow-up. So, patients maybe 2, 3, 4, 10 years after surgery may forget what we taught them. But if they are not following with us on a regular basis, we would not be able to reinforce the importance of these things as they go forward. So, taking the vitamins on a regular basis after bariatric surgery, and also having periodic tests to make sure that the levels of those nutrients are adequate is a critical part of being a healthy bariatric patient.